When I was a kid, drawing was a passion. I started sketching things from comic books, superheroes, and crime fighters. With time, I started drawing portraits, always of pictures, never of people I knew. That is, until April of 2007, a turning point in my life where my sketches took on a new meaning. I was no longer drawing fictional heroes, but a brave and strong little girl, given only a 1% chance of survival, weighing less than 2 pounds, and born 3 months too soon. My daughter, Mollie.
I was young and I was alone, but I was excited to have her in my life. There was no doctor in the room. I had her so fast, and I just was determined that once we were in labor, it was going to happen. And she came out perfectly healthy. I couldn't imagine my life without her, ever.
I met Jamie and her 3-year-old daughter Harley back in 2004. Jamie and I hit it off, and eventually we became a couple. After a few breakups and brush-offs, we tried again, and then that's when I got the best news of my life.
I was excited. I was very happy. I knew that that's what I wanted.
And we all wanted the same thing, that the baby would be healthy and
that we would be happy and everything, that she would be okay, because from the very beginning I was sick, and it was completely different, and it was just that gut instinct that this time, you're not worried about whether it's going to have your eyes or your hair color. You're actually worried about if it's going to have 10 toes and going to be healthy. I began bleeding, and it was first, the doctor said, oh, it's normal, it's just spotting, that happens. And then it became very significant. And I was hospitalized a couple times for a couple days at a time. I was always in and out of the doctor's office, and they put me on bed rest.
It's frightening. First it's my kid. Secondly, there's another little being involved in this.
They sent me to a specialist in Grand Rapids who, a week before Mollie ended up being born, said that the blood that was surrounding the placenta, and that was what was coming out, and that was going to cause my water to break early, and I needed to pay attention. I don't think I really found out I was going to have a premature baby, and I don't think that there's any preparation for it ever. I think they alluded to it, saying, you want this baby to make it to 28 weeks. Anything before 28 weeks, it's not really going to live. It's not going to have any normal life. It'll have all these problems. You just don't want to do that.
But making it that long was only a hope. Soon our worst case scenario became real.
My water broke, and I knew my water broke. I went into the hospital and had an ultrasound, and the tech, instantly, the look on her face, you knew something was wrong. My water had broken, and that the baby was okay. There was solid heartbeat.
The doctor told us they had to send Jamie to Spectrum Health in Grand Rapids, but they also gave us a startling and grim outlook on our child's chances of survival.
The doctor came in and said, well, we talked about this before. If the baby were to be born too early, you could just go home and let her pass.
So we had a really uneducated, very difficult decision to make.
The doctors used the word pass, but to us that meant going home and waiting for our baby to die. It was an unthinkable decision to make.
And all of us felt that it was no way we could just do nothing.
Even with the bleak picture painted for us, there was no chance we were going to give up on our child. The doctors gave Jamie a shot of steroids for the baby.
They loaded me in the ambulance, and down to the hospital we went.
So I ended up riding down in the ambulance with her, and she was scared all the way down.
And I followed behind, the whole time wondering what would happen. Once I got there, it seemed like hours till I found out more, but eventually the doctors told us Jamie would have to stay there indefinitely. But they hoped they could hold off delivering the baby for a few hours, maybe even weeks.
So Jamie's tucked into her bed and everything's going well. And she said, well, can I go to the bathroom? And they said, yeah, go to the bathroom.
And when I was there, the umbilical cord fell out.
And I heard Jamie say, this isn't right, something's out here.
And she leaned her head out the door and called cord.
Boom, all of a sudden there's 8 nurses or bodies all boom, 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 working all over.
He threw me on a gurney. It was overwhelming. I was being rushed into surgery and I knew it was bad.
We waited for what seemed like hours. Then, one of the nurses told us they were wheeling out the baby.
At one point, Jamie said to me, just maybe 2 hours before, if anything happens, Mom, I want you to stay by the baby. I'll know you'll be praying for the baby.
They wheeled her out and I could barely see her. It all happened so fast, we hadn't even agreed on a name yet.
And they were calling, here's the baby, and for whatever reason, I said, well, her name's Mollie.
My mom instantly started calling her Mollie and made sure that they started calling her Mollie because she was a person.
It would be another 2 hours of waiting until I could finally meet Mollie. The doctor walked us in. He told us what happened and what we were going to see. I was barely listening, and then I saw her. Mollie was bigger than I expected, and beautiful. I remember her being hooked up to all these tubes and all these noises, and she was still covered in blood. No parent should have to see their child like this. It was so overwhelming, I thought I was going to pass out. But it all came into focus when they let me hold her hand. It was so small. I barely touched her because I thought I was going to hurt her. As the monitors beeped, my eyes darted from there to the nurses to Mollie, and then Jamie came down.
I don't remember talking to the doctor mostly. I don't remember anything that was said. I know all of our friends were there and that Nick had been there the whole time, and he looked tired and terrified.
But I was also relieved in a way. Mollie seemed okay. She was alive. It looked like the hardest part was over. I didn't say anything to Jamie. I just gave her the most reassuring look I could muster. And we both held Mollie's hand.
I just don't think you can picture it till you actually see it. You can't picture something like that.
We held her hands for a while, and then Jamie left while I stayed with Mollie alone. I held her hand and sang to her. Some Beatles tunes, Amazing Grace, the song called Smile. It summed up exactly how I was feeling. Scared, uncertain, but smiling because I was holding my little girl. I stayed up with her for as long as I could, and then I said goodnight. The next morning at Helen DeVos Children's Hospital's neonatal unit brought no big change. I went in to check on Mollie. She seemed the same, still bloodied, but beautiful. The news from the doctors, though, wasn't good.
She had a very rocky, early postnatal course, and she had very severe respiratory distress syndrome.
And after a few hours off the ventilators, Mollie's struggling little body faced another hurdle.
In the third trimester, baby's lungs are developing dramatically. At the point where Mollie was born, if you picture her lungs as a tree, there were no leaves. That we're trying to ventilate her with the branches. And over time, she started sprouting leaves, and her lungs grew and grew and grew. And our goal is to ventilate these little babies as gently as we can and allow their lungs to develop as normally as possible. Mollie had a collapsed lung. She required a chest tube. She became quite ill.
I walked in the second they raised the incubator and they started working on her. She didn't look pink like before. She looked purple, like she wasn't breathing. There were what seemed like dozens of doctors and nurses working on her. I was pretty sure that was it.
And I just remember thinking, man, I hope she pulls through because she was in a rough spot.
Liza was Mollie's nurse that morning after the chest tube went in. She said everything would be all right. When the world seems to be crashing around you, those little words of encouragement from someone who's seen this before, well, they helped. But she also said something that rang true. It's going to be a long road.
She was just very ill. We didn't know if she would make it. It was day by day, hour by hour at times.
She was sick, super little, and her prognosis was not very good.
Mollie's lungs were so diseased that even on very high settings with very high pressures and very large amounts of extra oxygen, we weren't able to keep her blood red. Her blood was still blue. And we didn't want to traumatize her lungs with even higher pressures.
The lung is still developing. It's, you cause damage early on, there might not repair.
So we switched her over to a different type of ventilator called the jet ventilator.
It was terrifying. The sounds, all of the alarms, the machines, all the vents. Anytime the alarm would sound on her screen or anyone else's screen, you instantly check to see if it was hers.
The beeping and buzzing of the ventilator and all the noises of the unit became the soundtrack of Mollie's premature life. Sometimes Mollie would do well, other nights her numbers would be low, but a week after she was born, we got the call we'd been dreading.
So just the phone ringing, we knew it wasn't good. He said
That things didn't look good and we needed to hurry.
When I got there, things were calm. It didn't seem like there was anything wrong with Mollie except her numbers were low again. But something was very wrong. Her oxygen saturations dropped to the lowest I'd ever seen them, and the doctors and nurses rushed in.
they worked on Mollie a bit, and then they left, and but we didn't leave her side. It was freaking horrible, and I can't say how horrible that was.
That happened throughout the day. Mollie would come close to stabilizing, then she would crash. One of the scariest moments is when they pulled out the epinephrine needle, which they would use to restart her heart if she needed it.
And I pulled Jamie over and said, just talk to her, Jamie, talk to her, and I turned around just for a moment to say something to the nurse, and then Jamie turned around, and she's crying really hard. It's going to make me cry. I don't think I could do it. So she goes, why do you want me to talk to her? She's not even breathing. And I looked back, and Mollie wasn't breathing. The chest was not going up and down.
It's hard to process those memories. Seeing my lifeless baby turn purple. Throughout the day, they worked on her. She'd breathe, and then her sats would drop again.
She really shouldn't be alive.
One of the doctors we hadn't really talked to much yet came up to us and said that if we chose to stop treatment, that their team supported our decision.
At the point, I know that people were really convinced that whether or not she was going to make it or not was very questionable.
But Jamie and I both agreed that we were not ready to give up on our daughter.
I saw him first going to the hallway. Okay, so it's really stopped for 10, 15 seconds. So try to take pictures. So I couldn't even recognize because how tiny he was. Try to find out where the head was, those type of things. I was very afraid that he would not make it actually, because I couldn't believe how he would survive on that situation.
When I saw him, I didn't believe that was a baby. It was like so raw, like very red skin, and I was kind of a little bit confused. I was like, I could not believe that so tiny would survive. But I didn't want to touch because I was so afraid of break him, and it was scary. I think I was scared when I saw him.
But Victor, despite his tiny size, was tough.
He actually did pretty well in the beginning.
His first few days of life were not nearly as bad as they could have been. His lungs, which are often a primary concern for preemies, seemed to be doing well, But less than a week after Victor took his first tiny breath,
he got staph infection. I was rushed to see him, and really it was a terrible image, seeing, a lot of people around your baby, completely unresponsive. It was really the first really tough moment I saw. I mean, it's pretty much, he was dying over there, and he couldn't do anything.
Eventually, the staph infection cleared, but Victor was still far from strong enough to leave the hospital. So Mara and Daniel settled into the routine many NICU parents did and spent their days by their son's bedside.
Something that I think helped Victor a lot was we are always close to him. But I think they can feel that we are there and, giving him our strength.
Victor's health would swing from one extreme to the other, sometimes rapidly.
One day we'd arrive in the hospital and Victor would be just fine. And then we'd go home, and the other day they would call us, oh, he's not as well as he was yesterday. So it was hard.
After months of medications and respiratory treatments, Victor's doctors thought he was ready to finally go home.
We started to preparing everything, and we are so happy, so tired to be in the hospital after 3 months. And Amy was with him, his nurse, and she was like, I don't know what's going on with Victor because he doesn't feel right. And he wasn't, that he was really sick. They didn't know what was happening with him. And that, I think, was the worst part of my whole life, I want to say, because we saw Victor's heart stop 3 times, lots of nurses and doctors running and try to bring Victor back, and his heart was just 0 over there. So,
and even the doctor, this is some of those things that we probably will never know what happened actually, but was impressive how quick it went from
good to bad,
a good to a worst possible situation.
He had so many IVs on him that he didn't have any spots anymore to put more IVs. Everybody would come and say, I'm sorry. All the doctors and all the nurses, because they did not believe Victor would survive.
But his parents and the staff of the neonatal unit refused to give up on Victor.
Victor was a challenge for them. So then I just prayed one day and do you know, God, I'm lonely in here. Everybody's saying that Victor won't survive. I really need you to send an angel and talk with me because I really need to hear some good things. Otherwise, I cannot make anymore. I'm tired, I'm without hope. And I remember that was my prayer for God. And then at the night, I met a mom that his baby had been much worse than Victor, and she was leaving the hospital with the baby. And she was like, my son had the same thing, and he's fine, and he's going home. I was like, okay, that was the angel that I needed to hear.
Steadily, Victor's health improved, and 5 months after he had so hurriedly entered the world, Mara and Daniel were finally able to take him home.
And the first week, Victor would sleep close to us, and any little noise he would make, he would jump from the bed and see if everything was okay, even though the monitor was there.
As days and weeks passed, Mara and Daniel became more comfortable caring for Victor at home, and he began to thrive.
Yeah, I think home was just what he needed.
It's been 4 years since Daniel frantically sent messages to his parents about their grandson's early arrival. The panic and the fear has subsided, and what's left is a family. A loving father, a devoted mother, and an extraordinary little boy.
This is made us very aware. The life is not in our hands, it's really in God's hands. Those little tiny guys and girls are stronger than we think.
Everybody was worried she wouldn't make it. I mean, I think that was pretty scary. I had a couple of nurses, and I think some other parents that were in there said that if it's her time to go, she'll tell you. You'll know when to stop. And right now she's fighting, and to let her keep fighting.
The night Mollie crashed, we all realized how sick she really was, but the doctors and nurses never gave up.
Julie came over and said, you know, Mollie will tell you when she's ready to go, and you need to listen for that. But right now, she's fighting, and you need to fight with her.
Every kid's different, but I just get kind of that gut instinct of where it's going to go. And especially from the get-go, I didn't think it was time.
We all felt it was super important to let Mollie know we were there. I think that was part of what gave her the drive to live, there's no doubt. Because there's no excuse for her to be alive.
With all the waiting, there was a lot of time to reflect. For Jamie, it brought a lot of fear that everything was her fault.
I felt responsible and guilty, even though I had gone to the doctors and I had done everything they told me to do. I just started to beat myself up about that kind of thing, because when you see all of the medical equipment and you are supposed to be the one that prevents this from happening, I was just sitting there crying and being a mess. And Julie came over and said, has anybody talked to you yet? And I said, about what? She said, about the fact that you're not responsible for this. And that conversation with her that night changed everything.
While Mollie fought night and day in the NICU, it was also tough on Harley.
The first time she saw her, she was scared. She didn't know what she was looking at.
She was really small. I was kind of scared because I've never seen a baby that small before. I'm like, who is she? What is she? And then my mom said, you have a new sister. And I was really happy.
And I said, you know, yeah, she's got all that tubes and tape and wire and all that stuff all over her, but she's still your little sister, and she needs to know that you're there.
Harley drew some pictures of Mollie and taped them to her incubator so Mollie could see them. She even wrote a book.
Sister Magic, a Harley and Mollie story by Harley Samuels. Mollie is my sister. When she was born, she was very small. Mollie was in an incubator at the hospital. I love my sister very much. It is very hard to see her sick.
It was, I think, a routine. It just became, okay, I'm gonna go see Mollie and hang out at the hospital all day, and then I'm gonna go see Harley, and I'm gonna go see Mollie. Nick was down there when I wasn't, so we kind of traded time so that she was never alone, which worked out really nicely.
Oh, you got your eyes open on a video camera and everything.
For the next few weeks, we just waited. She'd have good days and bad nights and vice versa. But she was growing, getting bigger. Still, the only way we touched Mollie was through an incubator.
You can't put that into words. The first time I got to kiss her was around Mother's Day, and one of the nurses had said I was upset because there was another child that was getting held and played with that was kind of the same age as her, and it was hard to watch that baby get a little bit better and ours wasn't.
So that was actually an emotional moment for me.
She took me right over there and opened up the crib and everything and let me kiss her and touch her, and that was incredible.
But still, not being able to take her out and hold her because she was so fragile was really hard.
I think the best way to really describe it is that it is unnatural. You are supposed to be able to touch, hold, feel, love, nurture, comfort, feed your baby, and you can't do any of that. And you have to leave them behind at the end of the day when you go home.
When their babies are unstable, any type of manipulating them, turning them can cause their heart rate to drop. And she really was just sort of finally just kind of staying there, tolerating little movements here and there.
So the nurse, Vicki, went and talked to Dr. Jones, who was in the room, and she was whispering, and I was like, right, now what? Now what are you gonna tell me?
Finally, I asked one of the neonatologists what they thought, if it would be all right if Mom could hold. And he looked at me and he says, sure, why not?
Vicki comes over a few minutes later.
She told me she was going to go to have something to eat, and
she goes, I was just wondering if you wanted to hold Mollie.
And she looked at me like, what?
I was like, yes, I do.
I said, yes, make sure you eat.
So I ran and did everything she told me I had to do, and then I came back and they put her on me, and it was awesome.
I was, not her mother, but I felt almost as proud as a mother could feel to be able to see Jamie hold her baby.
She was so tiny, she fit literally it was like right here. It was really very small, but perfect.
A few days later, it was my turn to hold her. I was nervous, scared she wouldn't handle it well, but also emotionally overwhelmed.
What we found is that very gentle skin-to-skin contact for these little babies helps with their growth. It helps with their oxygen levels, and they do better.
She came off the ventilator 2 weeks after I held her, when before that they said she would never come off of it. And we held her every day that we could.
Eventually, Mollie was moved from the incubator to her own bed. Then, the rest of the family was able to hold her too.
The first time I held her, I was scared at first, and then I kind of got used to it.
It was so exciting to see her out in the open, but then they had to put her on something called CPAP, a large apparatus that helped Mollie breathe. But it was also extremely uncomfortable for her. But Mollie braved through it, and eventually she traded one contraption for a smaller one, a nasal cannula that gave her constant oxygen.
Hi. How are you?
It was freeing to be able to take her out of her crib and play with her and only have to worry about the cannula and the feeding tube. But something needed to be done to get that feeding tube out. After a long decision process, we decided she needed a G-tube, a tube in her stomach that would help her eat, which would also eliminate the tube that had to be shoved down her throat each time she ate.
I think the fear was that we'd already gotten off of the ventilator, we'd already come so far, and then you have to put her back on the ventilator for surgery, and will she come off of it again?
Dr. Gelfand, who quickly became Mollie's primary doctor, was instrumental in helping us make some of these more difficult decisions. He felt the G-tube was necessary for Mollie to get better and to go home. So Mollie went into surgery while we waited, hoped, and prayed she would be okay. Surprisingly, she did great in surgery and came off the ventilator pretty quickly. By the end of September, Mollie was getting better so quickly that we started talking about going home.
I was nervous. I had more nerves this time because is the house clean enough? Is she going to be okay at home? Is this really going to happen?
They're not meant to stay in the hospital all the time. They're meant to go home and to be with their parents.
And it was kind of shock and surprise because she had really done so much better at that time than I was thinking.
Everybody was awed and surprised and shocked at how well she was doing.
After 5 months trapped in the hospital, Mollie would finally be free. But just a few days after the good news, Mollie's health began a downward spiral.
Her stats went down, and she was clearly getting sick. I knew we weren't going home.
Jamie immediately found a sort of comfort in not going home. She knew it wasn't the right time.
I instantly accepted the fact that we were in the hospital and that it did not matter how long we were going to be in the hospital, just that when we were done being there, she was coming home with us. The acceptance made it routine, and it just was part of life.
On top of that, not only was Mollie not going home, but we also had to face another tough decision, a decision we had put off for more than 5 months. The issue revolving around Mollie's breathing. Would we continue to watch her get worse? She was back on CPAP and uncomfortable again. Or put her through another procedure, this time a tracheostomy.
I pushed for the trach to not happen.
We both didn't ever think it was time, but Mollie's worsening health was clearly a sign that something had to be done.
I wanted to hear her voice, and all the other kids with trachs, you couldn't hear them cry. You know, and there's something unnatural about not being able to hear your baby cry.
We're always hesitant to proceed with the tracheostomy because we know that it's an invasive surgery and it's one that's going to lead to long-term ventilation.
I'm supposed to have the baby that you dream of having, healthy, and take you home. I didn't want to not one more thing to be taken away, and I was really dragging my feet.
It's a foreign idea to put your kid through another surgery so early in life, this time one that would cut into her neck, attach her to a ventilator, and keep her from talking. But it was what had to be done.
I think that anticipation is sometimes worse than when it actually happens, because it is nice to get this contraption off of their faces.
It took a lot of time to get used to the trach, cleaning it, changing it, but you could tell Mollie was more happy and comfortable.
and made it better. And she was able to develop normally.
Despite having fought the idea for so long, I started to agree with Jamie's philosophy. Well, we're going to be here for a while. Might as well live with it and hope Mollie goes home soon. It wasn't long before we noticed Mollie reaching milestones many people never thought she would.
Watching the world through a child's eyes who has a 1% chance of living is incredibly different. You appreciate it more. You're paying attention to the reactions more.
Developmentally, I always thought, she was obviously a little delayed, but it was incredible, the things that she was doing. Smiling, interacting, hearing, looking, tracking.
She said key.
And we were all really pulling for her. And she got better and better and better.
Weeks passed, seasons changed. We spent the summer and fall in the hospital, and winter was coming quickly. Mollie grew. She had her first smile. We started hearing her talk through her trach. We didn't have any clear idea when Mollie would be going home, but as good as Mollie seemed, she was still sick. As Christmas approached, we got a wake-up call.
She couldn't get her air, and no matter what we were doing for her, she wasn't responding to it, and she was just so restless, and I had never seen her that way, and I was really afraid that she wasn't going to make it.
Her nurse Sharon called me at around 3 o'clock in the morning and said that Mollie was kind of freaking out.
So I got very scared and worried and was upset, and I made that phone call, and that was the hardest thing I ever had to do. I had made a promise to her mom and dad that if anything that I thought was not going to go the way that we had expected, I would call them right away.
So we looked for infections, we looked for viruses, we looked for bacteria, we looked for funguses, we looked for any type of infection that we could find.
I wasn't even sure that night that she was going to make it. It was like the first time that I ever recognized the fact that she might not go home.
We gave her some extra steroids. We didn't know why her lungs were going in the wrong direction.
Even he was surprised, and he kind of didn't know what to do at that point. So everything we tried, she just looked like she was going to slip away that night.
Why were her lungs becoming more inflamed? This is not normal for a growing premature baby. It didn't make sense.
So Nick and I both happened to be up here, and we drove down together and just sat with her. At that point, Mollie was sedated. She couldn't breathe, and she knew she couldn't breathe, and it started to scare her, which made her cry more, which made it harder for her to breathe. And she ended up on more medication and higher vent settings and just the whole thing all over again.
It was the first time I let myself cry. Once I got in the car, after that night was over, I just got in the car and cried and didn't think I was going to see her after that.
For almost a week, they kept her sedated. She barely moved. She wasn't the playful baby we were used to. We were faced with absolutely dire news.
That she would not make it through Christmas, and she might have been outgrowing her lungs.
This should all be quite dark. There really is not any normal lung tissue seen here at that time.
I remember they took like these beautiful Christmas pictures, and I can't help but even think later on when I see those pictures that here they're gorgeous, but here we were thinking she was gonna die.
A few days later, we had a huge meeting with the doctors about what could be causing this condition and what our options were. From the meeting we had, there was a possibility that she had something called PIG, or pulmonary interstitial glycogenosis.
PIG is a developmental disorder of the lungs where we call it the interstitium, or the supportive network of the lungs, becomes thickened. It's usually seen in a full-term healthy baby.
So it was extremely unlikely that Mollie, a preemie, had it. But some doctors, her lung doctors, thought the CT scan showed signs that she could have developed PIG, but not everyone shared the opinion. And the only way to confirm it either way was a risky lung biopsy.
The idea of doing a lung biopsy didn't make sense to everyone, to find out something that we already knew.
The picture was bleak. Again, we were forced to make a difficult decision, but this time we didn't have any answers. We were in uncharted territory.
She was so sick that we thought that she may not survive the lung biopsy, and it was a calculated risk.
Well, at first, we felt that the way they presented it to us was all, doom and gloom, and it was the worst thing that could ever happen, and this is awful, and she's not going to live through the surgery. And that made it 10 times harder to make the decision of, well, if they're telling us she's not going to live through the surgery, but she's not going to live much longer anyways, then what kind of conversation is this?
Jamie and I talked it over, both of us crying, facing the option of putting Mollie through a life-threatening procedure, or having a few more weeks with her and letting her die because of her failing lungs.
And I believe watching other babies pass away and their parents' devastation. I mean, I saw a lot of that. At this point, I'd been in the hospital for how long with her? And I knew what it looked like. And it was awful, and it was very painful.
So faced with that unbearable decision, we thought it over. Jamie spent Christmas with Harley. I spent it with Mollie in the hospital. Santa even came. Still in the back of our mind lingered that excruciating uncertainty.
I always focused on that early statement that she would tell me when it was time.
And they were so little. And McKenzie was 2 pounds, 2 ounces, and 14.5 inches long.
She was a healthy kid, just underdeveloped.
Madison was 1 pound, 9 ounces, and 12.5 inches long.
Madison had the diaphragmatic hernia, and she was the focus. She was the one with the most problems. I was shocked. I mean, you think of a baby, you don't think of a baby that small.
Genetically, they were identical, but the sisters' conditions were nothing alike.
Kenzie didn't have a whole lot of ups and downs. I mean, she had a few minor setbacks here or there, but nothing huge. Madison, she did okay the first few days, but we had a huge setback when she was about 10 days old, and we almost lost her. And there was many times with her, she'd take a step back, and we'd take a few steps forward, a few steps back.
They explain it to you. They call it a roller coaster. Ups and downs.
It was going to be a long road for Madison to come home.
Basically, when she was born, she had a half a lung. And they have surgeries for it, but her being a preemie and being born so small, they couldn't do anything right away.
They needed her to get bigger to do the surgery, but they couldn't feed her because of her intestines being in her chest. So she really wasn't going to be limited growth, so they needed her to be stable to handle the surgery.
While Madison struggled to be stable enough for surgery, McKenzie was steadily improving.
McKenzie kept me going as to knowing, she was doing so well.
Just before Christmas, now 2 months old, McKenzie was healthy enough to go home.
Every time you'd walk home or walk to the parking lot, you'd see a new mom with a new baby going home. But when McKenzie came home, I wanted Laura to come home and be wheeled out in a wheelchair like all the other moms. So that was the one thing that we asked, and it happened. She got to hold McKenzie on the way out of the doors of the hospital.
Well, I just felt odd because I wasn't, like the new mom, but I was in a way, but I wasn't. And then it's like so weird because it would have been more gratifying if it was both of them. So we enjoyed it, but it was nervous to think, okay, now I've got a preemie to take care of at home and I got a baby at the hospital to take care of.
With McKenzie out of the hospital, the holidays routine changed from always being at the hospital with their girls to splitting their time between Madison in the NICU and McKenzie at home.
It was amazing to hold them both at the same time and have them touching each other. I think they both really actually enjoyed it. And I think they could tell, and feel the love that they had for each other, even being so tiny. And so it's still touching to me to see their pictures of them together or when we were both holding them as a family. Those are the most treasured moments that I have.
Doctors were finally able to get Madison stabilized, and she underwent surgery.
She did have surgery a little earlier than they wanted to, but they figured as well as she was doing at that time, that was their best bet.
She pulled through better than expected. For a while, it looked as though Maddie's roller coaster would only have ups from now on, until things suddenly started to race downhill.
Got the call that she had reherniated. Her intestine had gone back up into her chest. I was freaked. It came back, she had pneumonia. And from there, it was just 1 step forward, 3 steps back. 1 step forward, 3 steps back. Her lung collapsed. And she still couldn't keep her oxygen saturations up. Basically, her other lung was failing. And it was either we make the choice to let her go, or she would pass away on her own. And so we chose to let her go just so we could hold her as she passed away. It took a long time for us to accept that was her life. They did everything they could for her, so she defied every odd. So I know she was a miracle in her own right. It was a blessing to have known her for 5 months and to have spent time with her, and for McKenzie to spend time with her sister. And it was hard leaving after Maddie passed, because it's like, it was just so sudden. Like, she passed and we won't be going there anymore. It was such a routine. It was so hard to be like, to not go back there.
Losing a child is the worst thing that can ever happen to a parent. But Steve and Laura had to find a way to balance their grieving for Madison with the joy of being new parents to McKenzie.
She sees pictures of Maddie and she'll say, "That's my sissy," or "I love my sissy," or, and if I say something about Madison, she'll go bring me a picture and she'll say Madison. And she'll always point out the right one, so she knows. It's just something she's going to always grow up knowing about. We'd think about her all the time, but, on days that they were born or her angel day, we just tend to do a little more just to make sure she thinks about her, or we'll talk about her. We usually do a balloon release, go to a children's museum, do something just as family and think about her.
When the doctors told Laura and Steve they needed to deliver their babies 12 weeks early, they had no idea what the outcome would be. While part of their lives has been marked by tragedy, when they look around their home, it's impossible to ignore the happiness and love that surrounds them, and McKenzie.
And it's amazing to see her grow up and to do things to become more independent. And, she has been a relatively easy baby, and toddler.
Pretty easy going, I guess.
She's been relatively healthy, and that's a huge accomplishment, to not be back in the hospital at all from when she was released. And I hope I can say that for a long time.
Dr. Galfin and I had a conversation before we decided to do it, and I kind of asked him what he would do, and he said, "I'd rather lose my child trying to save them than to lose them and find out I could have saved them."
So when it came to the point of her having a biopsy, I was genuinely scared when I was getting phone calls from Jamie that I thought for the first time that she might not make it.
We obviously relied heavily on the nurses' and doctors' opinions. Jamie and I realized we had to do something.
I knew that I had no choice. I had to do this, because if she did die and they found a disease that was curable in her lungs and I did nothing, I couldn't live with myself. I don't think any of us could.
It was scary, but we agreed it was the only choice.
That was a difficult day for everyone.
Mollie went to surgery and we had more waiting. I was nervous as hell. A few hours later, they brought Mollie back to Neo.
Mollie pulled right through. Yeah. And did extremely well.
She's a fighter because she made it through the surgery with flying colors.
Just a few hours after surgery, Mollie was kicking and playing and jabbering like any normal baby.
She was just kind of out for a day and healed very quickly and was a rock star about it.
But we were still left waiting. Did she have this lung disease that no other premature baby had ever been diagnosed with, especially a premature baby that had survived as long as Mollie? Either she had PIG and it could be treated, or she wouldn't survive and she'd outgrow her lungs. But I distinctly remember the day we got the diagnosis. My phone rang, Jamie was on the other end of the line, and she got right down to it.
That she did have this very rare lung disease and that there is treatment for it.
When we found that there was something else to treat besides chronic lung disease of prematurity, that was a wonderful day. I remember that day very well, and it gave us hope.
Mollie proved that statistics were just numbers right from the beginning. The odds were against her, but she defied them. The fact that she had this.
We knew of it. It was just not something that we routinely screened for, which suggests that maybe there were babies that had it and we just never got diagnosed with it.
And that's what sets Mollie apart from any other baby that any of us here have ever seen. And I don't think there's anybody else like her in the world. In the literature, there are less than 10 case reports of this particular disease, and she is by far the most premature baby that we know of that's ever developed this or had this by chance.
Of course, Mollie wasn't necessarily out of the woods yet. She was put on a burst of steroids that had their own side effects. Her cheeks started getting bigger, but all in all, her oxygen saturations got better, her ventilator settings decreased, and that all too foreign idea of taking her home started to become a possibility. A few weeks before, we were contemplating Mollie possibly not making it, and now we were thinking she might go home.
Yeah, the day Mollie went home, the entire unit was celebrating. I think she had a big caravan down the hallway, if I remember correctly. I was there, a couple of my partners were there. It was wonderful seeing her off to the elevator and watching her go see the rest of the world.
The biggest story I've ever had, you know, the longest child I've had on the unit, absolutely the sickest that I've ever had on the unit to go home.
We said goodbye to Liza, Stacy, Julie, Sharon, and Vicky, the nurses that had persevered and taken care of her for 11 long months, and the doctors, especially Dr. Gelfand, who fought so hard for Mollie and helped us through the toughest times. After nearly a year in the hospital,
Mollie got better. She was finally able to come home. That makes me happy. I was like jumping up and down. I was so happy. I ran out and gave her a hug. I was really, really happy.
I'm at home now.
Where's that diaper?
there was a lot of excitement having Mollie home, but there were also a lot of changes and challenges.
We didn't have nursing help that was adequate. So we began to take care of everything at night, everything during the day, and it was exhausting.
But it was also freeing to know I could walk downstairs in the morning and see my baby. But there were other things that took some getting used to.
When we came home, there was several doctor's appointments in everyone's office, every specialty that you were ever supposed to go to within the first 2-3 months of being home.
And there were a few close calls.
She slowly just got sick, and her stats started going down, and she just wasn't quite herself. And within an hour or so, everything wasn't fine.
Jamie actually started bagging her, you know, they put that bag over the trach and they're breathing for her, you know, and I'm thinking, you've got to be kidding. We've been through all of this and this is how she dies? Oh my God, it was horrible.
I think my mom thought she was gonna die in her arms right there. And it was very scary.
They rushed her to Big Rapids Hospital. Of course, this whole time I was at work, nearly an hour away, so I sped home, the whole time wondering if I would even make it there in time. But after a few days in the hospital, Mollie bounced back as she usually did, and we started getting on with life, letting Mollie enjoy it, watching her reach milestones, and celebrate her birthday. Her first steps.
Ready, set, go. Whoa.
Her first words.
I think it was Dada. I think she said, and I was totally offended and pretended not to hear it.
Mollie.
She said mama too. I mean, I think those kind of came out pretty close to. No, don't put that on camera. I don't know.
It was definitely Dada, or Gaga when Mollie said it. At least that's my story.
Oh.
And then another birthday came. And then another one of the best times of my life.
It was a little nerve-wracking, but it was exciting too. And she would pop off of her ventilator before, and then she'd take off running. And she thought it was hilarious. So you'd always have to go run back and get her and put her back on.
It was the day we got to take Mollie off her ventilator.
Ready?
Bye-bye. There she goes.
So the second we took her off and turned it off,
What are you doing?
she took off running, and she thought it was hilarious. And she's like, aha, you can't get me. And it took her a long time to realize we weren't trying to get you.
And after she came off the vent,
okay?
she started talking up a storm.
No eyes. You have eyes. What color? Hey, what color are your eyes? Blue. That's right. How old are you? You're 2. That's right. Blue. And you have blue eyes.
Show Mama your eyes.
You do blue.
Mollie's parents have been so wonderful sharing Mollie with the rest of us and keeping us abreast of all of her developmental milestones. So we've all seen her first birthday, and we've seen her come off of her ventilator for the first time, and we've seen her walk for the first time. And every time we see something new out of Mollie, it just brings a smile to everybody's face.
Milestone after milestone, Mollie continued to blow everyone away. Coming off the vent was a huge step.
The day they said no more vent, it was pretty cool. And we had to hold on to it for a month. And so I just stuck it in the closet, which was very cool. And then when they came to take it away, Nick wanted to leave his camera to make sure that we always had that on film, that Mollie's vent was sayonara. So it was gone.
There she is, my daughter. She hates being called a baby now since she's almost 4. She insists she's a grown-up.
What's it, Daddy?
It's really amazing to look back at the past 4 years. The trials, the fear, the uncertainty. It all seems so surreal.
Did I think she would be this awesome? Yeah, I did.
The fact that I get to see her whenever she's up here is just awesome, because then I'm constantly reminded, even on frustrating days, about why I'm here, what I'm doing, and that it does pay off in the long run.
Like, I've been here 10 years, and in another 10 years, I don't think I'll ever have that experience again because she's so unique, but I feel really fortunate to have been part of it.
Mollie reminds us of what babies can do.
I can't help but say that the power of prayer has got to be huge and phenomenal. That's what, I really believe that's what got Mollie through.
I'm amazed. I cannot believe how smart she is and active, and she's just great. She's, you know, the proof of what you do when everybody pulls together.
They're nice little reminders that, you know, you don't always know how they're going to turn out.
It's truly a miracle, and miracles do happen today, and she's definitely shown us that.
4 years ago, I started out my path as a father hoping to have a normal baby, to watch her grow and laugh with her, to read to her and watch her eyes light up. And that's exactly what happened. That path may not be what was expected, but the struggles we all faced have made us all better people. We formed lifelong friendships with the selfless nurses and doctors who saved Mollie. We've seen other parents overcome overwhelming obstacles themselves, all the while following the smallest of babies who have proven to be capable of beating extraordinary odds. Miracle is the only way I can explain our journey, and I can't help but light up every time I think about how much my little girl fought to survive and how Mollie continues to make so many people so happy. Do you think Mollie was a miracle?
Yes, I do. She was the best miracle of my life.
You want to play them?
Is this on?
That's the number. What number is that?
I'm free.
Hi.
Hi, I'm Baby Rosie. I'm Mama Audrey. Thank you, Dr. D.